have also started the live stream on YouTube, so the
Okay.
audience can ask questions there as well. And I'll be keeping tab on that. If they have any questions, I'll get back to you. Just a second.
Yep.
Yeah. I think we can start the session, sir.
Good, good.
Yes, sir. First of all, thank you so much, sir. Actually, sir, my camera is little above the laptop, so you might feel that I'm not looking towards you. It's my camera issue, actually. I'll look at you, so then you'll feel like that I'm looking towards the screen, but my camera is little above the eye line.
Right, right.
Okay, yes, sir. First of all, thank you so much for accepting this invitation, sir, and being here as a guest. I've gone through your career, and it's a textbook itself. There's so much to learn, and your experiences will definitely enrich and educate the audience, which I have. Probably most of them are medical students, but also
Ah,
the yes, and also the general people who are more aware about the health and want to know about the preventive cardiac health. So they have a perfect guest today, and I'll also get to learn so many things from you. So thank you so much for being here, sir.
well, the pleasure, Vishal, is entirely mine. And it's
Yes, sir.
particularly a sweet moment because I have had for years a great interest in all things Indian, including the Ayurvedic approach to things,
All right.
which has
Uh,
been largely abandoned by all of us, but needs to be resurrected.
it's the first point actually you've taken is about the Ayurveda. Uh, I
Yes.
mean, I want to start in a more organic way, like how you entered into the medicine and what were the key points in your era or key issues which you felt are little changed a lot or maybe changed a lot since that time period, sir.
Well, I actually had, Vishal, kind of what's called in America an aha moment, kind of this where this apprehension came over me as a high school senior sitting in AP biology. I can remember the moment like it was last week. And it was this impulse from the center of the being to become a physician. I didn't have physicians in my family. It was kind of a new and rather unexpected thing. And it became a guiding premise over the years that followed. So I went to medical school at Georgetown and then from there, took a residency in internal medicine at the University of California at San Francisco, and then joined the faculty at Emory in Atlanta, Vishal. And it was a very interesting thing there because the man who invented angioplasty, Andreas Grunzig, had suddenly become this world famous icon, sort of like Bruce Springsteen on the cover of Time and Newsweek, and found himself as a young man um, being feted and celebrated. And I had the pleasure of briefly meeting him and spending every moment that I could at his lotus feet. And it turned out to be a kind of seminal thing for me. It's one of those things where everything he said was, on the one hand, unexpected, but on the other hand, turned out to be true. So he planted the seeds in my mind, just as a young man at that time, uh, of the potential for us to expand interventional cardiology into arenas where it had never previously been deployed. From there at Emory, I went to UCLA in Los Angeles, California, did a cardiology fellowship, and then came back to Emory to do an interventional post fellowship year. And by that time, tragically, Andreas had died in a plane crash as a young man, but the seed of his thought was deeply embedded in my consciousness. So I came to Pittsburgh, and the first issue to tackle was the issue of heart attack and sudden death. And it turned out at that time, it'll be hard for the medical students to kind of put their arms around this, but the idea in the early days, in the 1990s, was that heart attacks were thrombotic events. They were blood clot related events. So what made intuitive sense was to use blood clot dissolving agents. That, Vishal, is like thinking about a three-dimensional system in a two-dimensional way, and you always get it wrong. So I had the moment of intrepiditude in the early 1990s of undertaking the first so-called primary angioplasty, primary meaning without preceding drugs. So a woman came in. I had known her husband, who was a janitor in one of the hospitals. She was having a large anterior wall MI. The traditional care then was to do the cath, see the arteries, and then deliver lytic therapy. Her first name is Cynthia, and I asked her if she was feeling daring that night, because this is something that we can not just sit and look at, but we can take issue with. So I went ahead and performed angioplasty. It was such a code violation, Vishal, that my scrub tech snapped her gloves off with a kind of, finesse, said she was leaving the cath lab as if the cath lab were a crime scene. But my
Mhm.
fellow and I went ahead and did the case. And by God's grace, it was just as smooth as it could be. And that ushered in this region, the era of primary angioplasty. We went ahead then, we being a group of large volume interventional cardiologists, and coalesced our experience and published a paper. So for the medical students, hang on, this was in 1993, and it was a lead article in the New England Journal of Medicine. But here's the embarrassing truth of it. So prior to that paper, 3% of Americans who had heart attacks or aborted sudden death were treated with angioplasty. The paper comes out, and at the back end, the same 3% are getting the proper treatment. So we showed that the satellite photos proved the Earth is really round, but everybody kept going to the Square Earth Society, and we couldn't. And it wasn't until 5 years later when I undertook a study looking at cost. Of the group of interventional cardiologists, I count myself the least skilled to deal with the issue of money, and but they asked me to do this. And so what it involved was figuring out what's the difference between a hospital cost and a hospital charge. So the hospitals had to get naked above the waist and show us that data. And the surprise was that doing the right thing was less expensive. And so this is sort of the homily for our young people now embarking on this. There's a turn of phrase in America, which is follow your bliss. So you know the answer before you can articulate it. You understand a poem before you know what it means. So going with that little impulse is so important in our careers, to not be afraid. Just move ahead, because the physicians know so well what the right answer is. A lot of the issue has to do with trusting our instincts. And as it turned out, now these 25 years later, there is no more lytic therapy. Everybody with an acute ischemic syndrome gets that finds their way to the cath lab. We published a slew of papers that followed that, that looked at, well, what if you don't come to a hospital that has a cath lab? Then you transfer the patient. What if you're old and excluded from the old lytic trials? This is what works best for you. So the sun shines on the just and the unjust, and angioplasty works on everybody. And so now that's become really the standard of care. And it introduces an interesting premise. And the premise is not that angioplasty is better than these competing techniques, but that we, as healthcare providers, are better at taking care of what we know. So the first thing we did was learn the coronary anatomy, and then we knew what was wrong with you. So if you go to the Italian tailor, he takes the measurements. You come back next week and have the perfect suit. So that idea of taking the time to understand the details, the really the granular details of our patients, and then cognizing an agenda of care for them. So, in a sense, then, this was really an example of, if you will, aggressive prevention. So we prevented the infarct from continuing along. We prevented old and middle-aged people from becoming aged, and young people from becoming middle-aged by losing their ventricle. Everything changed. Everything changed. And one other thought for the medical students in particular. In America, during the decade of the 1990s, we had people who were interventionally oriented, stepping into the area of risk reduction. And if I may, risk reduction had been kind of the weak sister sport. It was always, you know, um, thought of as a little bit lower on the on the feeding chain. But in actual fact, when the interventional cardiologist started seeing with their eyes what a heart attack was, what sudden death was, they took a very muscular approach, fixed risk, dropped LDL to 50. Turned out that just over that decade, the occurrence of heart attacks in America dropped by 1/3. And the reason may well be that we really flexed our muscles. We didn't take this kind of mealy mouth approach. Just conquer the beachhead and do it now. And I think looking ahead, that's one of the fundamental issues for our young physicians now. Risk reduction is everything. It's not a soft point like floss your teeth once in a while, swing by church. It's a fundamental mainstay of forward-looking care.
All right. Uh, so as we know recently, first of all, thanks for that answer, comprehensive. Uh, as we know, so recently the incidence in India, particularly if you are aware about Indian subcontinent, the incidence of the MI have like skyrocketed, and even in the
Yes,
sudden, even in the young adults as well as maybe adolescent age, some of them are related to the structural heart disease, but there is also significant rise in the thrombotic MI. So, what do you think
yes,
that actually, and there is a very common myth about the COVID vaccines or the COVID disease per
yes.
se is one of the causative factor in this incidences. So, what's your opinion about that, sir?
So I think that, it's so important that when you have access to the microphone with a little red light on, that you be very careful about what you say. And I just, for example, did a television show here in America a couple of days ago. It was a national broadcast, and one of the other guests brought this issue up, pointing out that the COVID vaccine is associated with the rise of malignancy in America. You may be aware of in India, there's been a rather unexpected rise in thrombotic events of all sorts. Here's the thing. Um, the first thing is for us not to take the bait and relate things that, in other words, to make relationships when they're not organically present. Okay, so what's true about the COVID vaccine is that it is a bit more immunoprovocative than was initially understood. And what that means is that there's an exuberant production of antibodies which are not perfectly crafted for their target. So it's what the old doctors called serum sickness. That's why people get myocarditis. I'm the cardiologist for the World Wrestling Entertainment. It's a huge group of principally young athletes. And in that group, we did see more than what you might expect of myocarditis in healthy, principally male athletes. But remember, what is a heart attack? So a heart attack is the abrupt cessation of blood through the coronary arteries. The word coronary comes from the Greek. It means crown. So these arteries crown the heart. They're not actually embedded. They ride on the heart. And what we think is the basis for these infarcts is abnormal calculus of blood flow. Dr. Grunzik one day was walking down the hallway at Emory when I was just a young pup. And he stopped and he looked at me and he said, "Isn't it interesting that the sandbar is always present at the bend of the river? So where the river flows straight, whatever is in solution stays in solution. But when the river takes a bend, all of us who have suffered through physical chemistry will remember that's when the silt settles out. And over the eons, that's where the sandbar is. Likewise, in the heart arteries, when the blood supply through the heart arteries is robust and has normal laminar flow, blood doesn't clot. Any disturbance in that rheology, the calculus of blood flow, creates agitation of the platelets. Remember that the blood is not like water in the garden hose. It's alive, it's sentient, it's self-aware. So these small, modest plaque narrowings it's like driving your car down a cobblestone street. You're spilling the coffee on your lap, okay? And this is what's so interesting. One of our colleagues in the primary angioplasty study looked at the severity of the narrowings that cause heart attack and sudden death. And the fascinating thing is that 70% of people who have heart attacks have a 50% or less narrowing that caused the problem. Just think about that. So, so that means that these rather non-obstructive, lipid-rich lesions that if you got a stress test, you would pass it. If I said to you, "How are you feeling?" It'd be fine. That's why there's in America 350,000 people a year with sudden cardiac death. They're not stupid or uninformed. This was the first presentation of the disease. So if you get the flu, you feel a little scratchy throat today, and tomorrow a little muscle aches, and the next day you feel nasty. So it's a slow windup. Not so with vascular disease. So the acute MI issue relates to those basic underpinnings. COVID has to do with exuberant antibody production and maybe myocarditis, which is almost always self-limited, involves the heart muscle, not the arteries. So we have to look at, and we're having the same experience that you are in America. Young people now are presenting with a number of uh, vascular diseases that were really
Mhm.
limited to people like me in middle age. And I think this is what we have to think of. We need to think seriously about the intima, the single cell lining of all vascular structures. Intima comes from the Latin intimate. It means inside of. And this is the governing intelligence of the entire vascular system. Vascular disease is not plaque narrowing, it's loss of that governing intelligence. It's what happens to you when you're angry and drunk. You don't have that kind of parentis on locus, that governing element of your conduct. So these mild plaque narrowings, when they're lipid rich, and in India, a lot of people have um, left the traditional Indian diet, which was, in my judgment, the best diet in the world. So and it's my sense, though I can't demonstrate this to you in a prospective fashion, that a plant-based agenda is simply the proper way to honor the body. Having said that, many people of Indian origin, both on the subcontinent and here, really have no, and are even quietly rebelling from grandfather's agenda. And there's a price to pay for that. Grandfather had a wisdom that we should be slow to shed. And so I think that it's the old example of we have met the enemy and he is us. So our own conduct is likely at the ground basis of all this. And that's not an indictment. That's not finger wagging. That's an opportunity. So if we have the helm of the boat, we can decide whether we round up or fall off. And I think it's very important for us, even now at young ages, to properly steward the body. And my experience is we steward the body when we're out of our comfort zone. It's not the diet should be deliberate. It should be thoughtful. It should be well curated. Um, and very often, particularly for our young medical students, the last thing they're thinking about is what they eat. Their deck is full. But it's so important for us just to take seriously the premise of honoring the body. And one of the things I hope to do with you is outline the details, the granular details of what that would mean.
Yes, sir. Um, so next question is about the medicine and the cardiology per se. There is a evolution across the theory knowledge what we had earlier, the bookish aspect of either the auscultating or maybe taking proper history, to now evolving to directly doing a 2D echo and going for a procedure. So do you think that it has to be this way or it should be in a traditional fashion?
So, again, let's be careful in a moment of youthful exuberance to abandon our techniques. Let's be careful about that. And so I did a show like this the other day, yesterday actually, in America. And the comments of the callers were things like this: my doctor doesn't touch me. My doctor doesn't look in my eyes. My doctor doesn't listen to my chest. So we have come to have this moat around us that separates us, like the river around the castle, from the people. And and here's the thing, doctors know it too. And doctors long for the missing ingredient here, which is the relationship. There's a wise man in India who was once talking to young acolytes. And he said, interestingly, he said, what does it mean if we go to the doctor and he gives us the pink pill and we go home and flame test it? What it means is we went to the wrong doctor because we don't have the relationship. So the magic of healing begins with as the French said, the je ne sais pas, the without which there is none of the relationship. So we've kind of hidden behind all this. Well, we have to, no, we are servants first. We're servants. This is not about us. The finest physicians that you know are simply uh, what is described in the scripture as exalted servants. So we need to, um, and in America, some interesting things have happened about this. Actually, it might interest you that there's a cardiologist from the University of Pittsburgh Medical Center of Indian background who saw and felt this. And he developed something called a bridge, one word, ABRIDGE. A bridge is taking the world by storm. So this is an ambient listening device that so you can see your patient, you can talk to your patient, You can have a relationship with your patient. And the ambient listening device separates the wheat from the chaff, creates a note as we're speaking, imports into the note the relevant aspects of the medical record, and the doctor walks out with a written note. So, in lots of disciplines, 70 or 80% of the physician time is spent writing notes. So it's been our experience that technology works against physicians. It makes it harder for us to, but that worm is slowly turning. So I think we're going to see that over the next 5 years, this technology will kind of penetrate into the larger medical ecosystem, and we'll start finding things that help us. Of course, we listen to the heart. We listen to the heart. Ask yourself this. If you go to the symphony tonight and you know the symphony, all the ups and downs, it's a much richer experience than going there and not knowing anything. Likewise, if you listen to the heart, it raises the questions. It may not give you the answer, but it raises the questions. So whatever studies you get from there are targeted. So if we have an old man who comes in and is a little short of breath as he's walking down the path in his village, and we listen to his heart, the one thing we can't miss as doctors is a lethal but treatable disease, say, for example, aortic stenosis. So we have to be able to recognize that at the first moment of inception. Failing to recognize that leaves him at peril after he entrusted himself to us. That's a code violation, okay? So we're not going to abandon reading EKGs. We're not going to abandon taking the time to listen carefully to the patient. Listen to there's an old adage that the eyes are more sensitive than the hands, and the hands are more sensitive than the ears. So you look at the chest, you see the apical impulse, you feel it gently with your hand, and then you listen because now you know what you're listening for. And those old clinical saws continue to be true. Our goal is to add to our technology, add to our uh, 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 service capacity, not take away from it. So, yes, listen to the patients in all regards.
For sure, sir. It's a quite a trend actually in India, because uh, the residents most of the times they have around 200 of patients, or maybe around 300 of patients the OPD per se. So it becomes really difficult. But I'll for sure I try to emphasize more on the clinical. I also have a knack in the teaching actually. So whenever
Yes.
yes, I'm on a round, I used to teach I used to educate them, teach them that this is how you examine and stuff. Make it a little interesting. I tried to take some quizzes, and many of our students on the Instagram actually had posted those quizzes also, who loved them actually. Uh, so thank you for your insight on that as well, sir.
But think about this, just as you said. So
Yeah,
now here comes there's 200 people to see.
yeah,
So we're not going to get 200 echoes. God
yeah,
knows.
yeah.
Okay. So if we just did this much, if we just approach the patient from the right side, not the left, we felt the apical impulse, we would know right away whether there's aortic impedance. Right away. That took shorter time to say than it did to do.
Actually,
And so if and that's again, it's easy to miss things that we really can't miss. So and this rushing, yes, we have to get through a large number of patients. We can't turn these into career opportunities. All of that is the case. On the other hand, we need a certain, as the French say, rigor of the day. And the rigor of the day is that we establish a relationship. We steer the patients right from the get-go in the direction they need to go. And you know that when you first see the patient. As you gain experience doing this, T.S. Eliot, the great American poet, once wrote, he said, "You understand a poem before you know what it means." That is to say, that intuition precedes cognition. So the eighth grade teacher may say, what does that poem mean? And you stumble and become a little bit tongue-tied, but you know it in your heart. So the heart precedes the mind is the point. So when you look at a patient, you can kind of gather the story. You can sort of feel the whole thing and then kind of guide your intervention. It does not, it takes less time to do the right thing. It's less expensive to do the right thing. And we can't get away with, oh, I'm just so harassed. I got this lock of hair over my eye because I can't get it out of the way. No, get it out of the way.
Okay, for sure, sir. I think whoever is watching this video on YouTube, also on Zoom, have definitely got this as a lesson. Mm, So next question is, as we know, the entire world per se, and India actually very closely follows the American standard, American guidelines, particularly American Heart Association. So, do you think that the till now or in future also it should be in the same way, or we should look for the diverse or maybe diverse guidelines from the Indian subcontinent, because there are different numbers of patients, the genotypes are different. So do you think the studies should be established in a different zones even by the AHA?
Yeah, that's really an important thing to say. And so there's no example that you or I can think of where one size fits all. Okay, so it is the case that, for example, in America, there's been an effort to stratify out different ethnic groups. And I feel like we've gotten a little far out on that issue, probably more based on a political enthusiasm than actual biological enthusiasm. But so now there's this what's called multi-ethnic study of atherosclerosis, MESA. And so of course, like look at India. So vascular disease is so much more prominent in the southern aspect of India than it is in the northern aspect of India. And there's no ethnic understanding of that. And you can't say, well, there's lots of coconuts in the south and not in the north. It's a mystery. It's not, it's always interested me. A famous Indian musician, sitar player, that were I to say his name, everyone it would listening and watching would know him. Uh, Came to San Francisco when I was a young resident at UCSF with this extensive three-vessel coronary artery disease, seeing at that time the best cardiologist in the world. And it struck me as to, I mean, here's this man with this rigorous um, vegetarian diet, um, and no clear evidence as to why this should be the case. And there it was, which points out there's mystery in this. There's lots of things that we don't know. And you think about at the time of the birth of Christ, the scriptures, Mary pondered these mysteries. So she didn't try to answer these questions. She just let them kind of roll over easily in her consciousness. Likewise, in thinking about these things, we know that there's a variety of factors that interpose themselves on the lining of the heart artery. Some of those factors we all share, and some we don't. So why is it that there's that ethnic divide in India? No idea. This was in the late 80s, and I still don't have an answer to that. Here's what I think. I think that you start off at a much more auspicious location in India than we do here because you have a tradition of what I personally believe to be proper diet. Um, and so it's not so. So I understand that that people in their 30s and 40s and 50s have largely kind of shed that tradition, but it's one that's familiar to the Indian subcontinent. And I think it's worth our while to maybe revisit that a little bit. I think that there's are these emerging risk factors which have interested me for years, actually for decades, like lipoprotein A. And this is a very important subfraction. We actually published the first paper back when I still had acne on re-narrowing or restenosis after angioplasty. And it turned out that the single predictor of restenosis was serum lipoprotein A. So that should be measured routinely in our new patients, routinely, because you can have a very low LDL, very high HDL, no triglycerides, And there's that one snake in the grass, and it's the only one that needs to be there to kill you. So we need to start looking at that and these non-traditional risk factors a little bit more carefully. Um, I think that that we should curate in the same way that food should be local, diet should be local. So you have a huge advantage in that you produce all these things. You produce all, look at curry. Curry is basically turmeric, it's an anti-inflammatory. The old Indian diet is so wisely structured. Okay. When I go to health places here in America, which isn't very often, but the diet is always this deep vegan, and it's, as you eat it, it's the right thing to eat. You just know that it is. So I feel like you start off in a much more advantageous position to introduce that to Americans is to ask them to only speak Tagalog, and that's likely not going to happen. Okay.
Right.
But I feel like you should resurrect some of your own dietary traditions. I have seen, though, it is the case. So I have a large number of one of my partners is, I have a large number of Indian patients, and it turns out that there's a temple here in Pittsburgh, which is one of the auspicious temples in the Hindu tradition. It does appear to me that there is an accelerated occurrence of atherosclerosis. Here's the thing on this. However you got it, and whatever its degree of severity, this is a reversible premise. Okay. So we showed actually for the first time in San Francisco. I was just standing in the hallway, wasn't in any way involved except as a spectator. But these arteries can heal. So fixed plaque narrowing can resolve. And here's the interesting point for the medical students and others to ponder. It doesn't take much. So if you reduce plaque volume by a tenth of a millimeter, think about that for a second. Imagine the water in the river is just above your nose. And I can't get you out of the river, but I can lower the water till it's just above your upper lip. All the difference in the world. So it is with these heart arteries. Small regression of plaque narrowing leads to huge reduction in bad events. Okay. So the idea is we can do that and we can do it. I'm a big fan of lowering LDL and really lowering it, not fake lowering it. If I drew your LDL when you were 6 months of age, what would it be, Vishal? Zero. So in our native state, in our unmolested state, we don't have rust in the water. So what we've done is decide that a certain amount of rust in the water is normal, but it's normal in a disease process that takes out one of two of us. So that's not normal. It's just what's arithmetically normal. So lowering LDL, in all the people watching should know their LDL. You can have that done in India, lickety split. So you should know your LDL and it should be low. If it's not low, you should get it low. Um, and we've developed these kind of platforms, Vishal, of what is really right life. And it might interest you and your viewers that a lot of this comes from the Ayurvedic tradition. I've kind of lifted it out of. So the basic routine goes like this. Morning is the time for prayer, meditation, and activity. So we should all arise just as the sun is breaking the eastern horizon where you live. We should have our time of devotion, of silence, and of physical activity. Your insulin levels are low in the morning. So when you do any activity, the only way the body can support that is the liberation of deposited fat. So that's a good thing. Then as the sun is rising in the sky, the fires of digestion are becoming hot. So the fires of digestion, if you throw fuel on the fire when it's a roaring inferno, you get combustion. If you throw fuel on the fire when it's a glowing ember, you get smoke. So you want to take your meal when the sun is high in the sky. So calories should come between noon and 6. We should avoid those evening calories for those kinds of reasons. Turns out in the Vedic tradition, the body is preparing for sleep beginning at about 6 in the evening. So we don't want to be taking the meal, coming out with your friends and going to the show and eating at 9 o'clock, like in New York. It's just all wrong. So the meal is done by 6, and we're in bed by 10, remembering, as they say in India, that 1 hour of sleep before midnight is worth 2 hours of sleep after midnight. So a wise man in India once explained it that there's these angel trains, and you'd like to catch the first angel train, which leaves at 10 o'clock. If occasionally you miss that, don't miss the second angel train. It leaves at 11. And if you miss that, never miss the last angel train that leaves at midnight. So those basic, if our viewers and listeners just try to adapt some of that without becoming, and again, another tradition from the domain of the Ayurveda is that we favor certain things. We're not ideologues. We don't. So your friend calls you up and let's have dinner tonight, and you go, that's fine. But as a rule of thumb, these are the governing premises of conduct, and just those things, hugely lower forward-looking risk. The agenda should include 3 hours of exercise a week rather. 3 hours of exercise a week lowers, listen, all-cause mortality by 30%. 30%. That's the best deal any of us have ever made.
Yeah. Yes. I think as a many Indians as well must be feeling actually really proud about what we are, I mean, usually eat and the traditions we have. So for sure, after this enlightening talk, we will definitely focus more on the basics, I guess. That's very important because during the westernization and the current generations growing throughout the Netflix era, what we say, the
Right.
everyone wants to live like a and have that American food, and the outlets are also getting quite popular in Indian scenario. So for
Yeah,
sure, I
right.
think we'll focus on more on this now, and actually it helped me a lot. I'm not a much a fan of a fast food though. I
Good for
like
you.
very simple Indian food, but many of the viewers, I think they'll be really happy after saying this. So next question is that about the various cases about the in cardiology right now we are seeing some hidden cases are there, either about the stem equivalence or maybe about the aortic aneurysms as you mentioned in one
Yes,
of my videos. So
yes.
what are the blind spots in the cardiology which actually a newbie or maybe a young physician might miss?
So it's interesting that um, let's talk about aortic aneurysms, and let's just go back and think primarily for our medical students. And if the question was asked, what pumps the blood to the body? Everybody would take the bait and fill in answer B, the heart. But that would be wrong. The heart contracts with such vigor as to almost eliminate the time coefficient. And that means the blood enters the aorta over a very short time frame. So the aorta dilates to accommodate that blood and then snaps shut. So this was described in the 1920s by the Germans. So it's called a Windkessel or wind chamber. So it's the aorta and its elastic component that actually provides the animating power of the blood passing through the body. And so, not surprisingly, that creates for the aorta a certain kind of parallel. So this is the most violent place in the body. The blood exiting the heart is a tumult. And so you can imagine that, for example, well, let's think about aortic dissections in the as you were talking about the other day in type 1 dissections. The aorta is composed of three layers. And so there's the intima, there's the media, and there's the adventitia, with these jets of blood roaring out. Not so surprising that occasionally that blood actually, if the angle of engagement is wrong, can actually penetrate the intima, that very discrete, subtle cell layer, and enter into the plane between the media and the intima. And so here's something that the medical students will remember, Puceau's law. So we remember the French chemist physician who described the relationship between the radius of a sphere and the distending pressure. And let's just unpack that. So it turns out that the distending pressure on a sphere changes as a function of the square of the radius. So what does that mean? So if the radius goes, say, from 2 to 4, then the delta is 2. So the pressure is 2 squared or 4. It's not arithmetic, it's that exponent. So when the aorta over the years, say with mild high blood pressure, becomes distended, say the normal transverse diameter of the ascending aorta is 38 millimeters, some say 40, let's just say somewhere in that. So now it's 42 or 44. So is that such a big deal? Turns out that it is, because that delta squared is the change in the distending pressure of the aorta. So it's an important thing to note that in this area, when you get the echo, um, among that field of 200 patients we had to see today, make sure and look at that, because what we'll find is so many people have a little bit of an increase. Why? Because we undermanaged hypertension. I'll tell you the other here. There's a man who is a president, CEO, and founder of an incredible company that makes all this technology to protect people against sudden cardiac death from the ball to the chest and all that. And from a distance, I was looking after him. I got a call um, that he had been in a meeting at 9 in the morning and felt suddenly horrible and put his head down on the desk, didn't lose consciousness, was going to a little ER outside of Philadelphia. And the doctor was thinking, well, maybe he's having a heart attack. So the staff of this man called me, and and the transverse diameter of his aorta, he had come to Pittsburgh for a little, checkup, was a little bit increased. So I asked the doctor in the ER, forget all the heart attack stuff. First test, get a CT angiogram. The first test he got was a CT which showed a type 1 dissection. In the annals of medicine, the single most dramatic clinical curve is the relationship between mortality on the ordinate and time to diagnosis on the abscissa. So if you make the diagnosis within 30 minutes, everybody's okay. If you make it in an hour and a half, lots of people aren't okay. So it's important just to put this little kind of vignette in your mind as a young physician, that what is it we can't miss? A lethal but treatable disease. Well, this is the all-time example of that. So we want to manage blood pressure properly. And what does that mean? So there's a recent trial in America that looked at 130 millimeters mercury or less versus 110 millimeters mercury or less. You might say, oh, at 110, people be swooning around and falling. That's all fake. It's all baloney. So the 110 or less group, of course, is the winning group. And now we can see that it leaves the aorta unmolested. It's like the farmer's hands getting slowly calloused because of the injury of pushing the plow through the field. So now he begins to have a gentleman's hands. So the key thing is afterload reduction in our patients with high blood pressure, not using beta blockers and these old things from the 1980s, but afterload reduction. So losartan, ACE inhibitors, those kinds of things. It's also interesting to think about what you were talking about the other day, Vishal, on abdominal aortic aneurysms. Let's ask ourselves, so now we can see why type 1 dissections would occur, because we're trying to drink our water out of a fire hose. Fair enough. But then there's this whole thing that we skip until we get to the descending aorta, just at the point of bifurcation of the iliac arteries. That's where all the aneurysms. Why are they there? Well, the reason is because, remember, it's the aorta that contracts vigorously and propels the blood through the body. So that contraction wave comes round down to the belly button where the iliac arteries arrive. And that's why there's a reflectance. Think of when you're in the shower and you sing a note where even you or me sound like Pavarotti, just for that one note. So that means that this frequency of the note is a function of the size of the shower stall, and we have that moment. That's what happens in the aorta, where the iliac arteries come off. It creates a pressure wave reflectance, just like Dr. Grunzik, that it's not laminar. So it was getting transmitted fine, then it divided up, and you can imagine that there's those backward pools of pressure. That's why people get abdominal aortic aneurysms. It's a big issue in America. Between 40 and 50,000 people a year die of rupture of that aneurysm. And so part of our exam, um, medical students, is we begin at the apex, we look at the apex, we feel the apex, we listen to the apex, we put our fingers into the abdomen just below the xiphoid process. The way God made the body, he put all the really important things at the back. So the spine, the aorta, they're way in the back. Fake things like the tummy and all that, they're up in the front. So we have to press down and feel. You can feel with your fingers on either the second and third finger on the left, second and third finger on the right. We can feel the size of the aorta. That took us 1/10 of a second. And with that, we never missed anybody who had an abdominal. And if we're not so sure about it, then we get the abdominal ultrasound. But we can't miss a lethal but treatable disease. And so those are some of the little vignettes. And the real answer is the aorta is an innocent bystander. It gets it gets whacked upside the head by blood pressure. So blood pressure is the heart and soul of reducing this risk.
Yes, sir. Uh, Next question would be, sir, about the five key things for the preventive health according to you. You already mentioned about the lipoprotein A, LDL. Would you like to diet also you mentioned? So what will be the key five areas one should know as a viewer who is a non-medico or even a medico? Actually, the incidence is increasing day by day in medicos as well because of the hectic lifestyle. So what are the key five areas one should keep check for the best heart health?
So all of your viewers, Vishal, and there's so many of them, congratulations. All of your viewers know when they go to bed that they latched the back door. Ask yourself, really, how much risk reduction do you get? Because probably the guy's not coming in the back door tonight. But we do that. Yet, as a wise man named Maharishi Mahesh Yogi once said, he said, isn't it a shame that we leave the most important aspects of the life up to chance? So let's not do that. Let's not do that. So the first thing, as Socrates said, is to know thyself. So know your numbers. You know how much money's in the bank. You know the phone number of your girlfriend. Know your own numbers. Okay? That's not much to ask. As a rule of thumb, as a rule of thumb, all of us listening, speaking, should have an LDL way below 100. Just as a rule of thumb. The guidelines are a little more flexible, but let's talk among ourselves. We should have triglycerides way below 150. Triglycerides relate to carbohydrates. So, and they're the fastest, most fleet-footed lipids there are. So if you were a little bit porky in the middle and you ate lots of sugary products, your triglycerides would be elevated. When you stop doing that, they melt like the snow in the Himalayas in the summer. Okay. So there's no excuse for elevated triglycerides. That's just sloppiness. Okay. So I want people first to know themselves. What is and usually if we all are honestly taking the scale firm in hand, we have ways of improving ourselves. But so know that. Second thing is go to the bathroom, stand in front of the Florida ceiling length mirror, naked, and ask yourself as you gaze in the mirror, how good a job am I doing? And we would find for all of us that there are ways of modifying our current risk. So that brings us to this issue of exercise. The thing about exercise is that it's not a penal colony. And it doesn't matter where you are now. Let's say that you're 74 and you weigh 40 pounds more than you should, and you hear some young pup talk about exercise. You resent the premise. Let's remember that our idea here is to care for our future self. This isn't about the vanity of the moment, which consumes us all. This is about that more abstract premise of caring for our future self. If you think about it, there's three ways generally to die. So vascular disease is by far and away the most important, malignant disease, and cognitive impairment. I'm going to submit for your consideration Vishal, that when the again, borrowing a metaphor from Maharishi Mahesh Yogi, when the wise gardener waters the root, all the plants grow. So watering the root is the fundamental thing. That's how the sap rises up and becomes the thorn, the petal, the flower, the stem. So watering the root means just right life, right life. So it's not about what you like or what you don't like or all of this endless self-absorption. It's about the humility and honor of serving, in this case, serving the body. So, right. Know yourself. Know your parameters. Have a long look in the mirror, just like you might inspect your checking book. How much money do you have, or the heating bill, so forth. Look at yourself. Look at and ask yourself. I want everyone watching and listening to have as their goal that they should weigh throughout their lives what they weighed or should have weighed at 21. So why would we think it's natural to gain weight? It's not natural to gain weight. It's just habit and custom. Okay. And by the way, people, in my experience, that really do eat the kind of signature diet of traditional India, they're not heavy. They're not heavy. Okay. So, and I'm going to come back to why is it not so good to be heavy, but so I want that body mass to be well controlled. The third thing is what we talked about briefly, the exercise thing. Remember, that's 3 hours a week. Let's talk about that a little bit in more detail. One of the things that we've lacked in advising people is the importance of resistance training.
Yes.
So people who in America, Jane Fonda was this leftist who was all over the place telling everybody to bend and flex, so forth. Resistance training is really important. For our older listeners, this idea of sarcopenia comes from the Greek. It means impoverished muscle. So, so we begin to lose muscle mass, and then everything goes wrong. Your joints become less perfect. The joints are surrounded in a loving way by muscle mass. Consider the knee, for example. So many of our listeners today have a little bit of discomfort when they walk. The way God has things worked out, these four giant muscles in the thigh, biggest muscles in the body, they surround the knee and embed in the tibial plateau. So the knee is like always covered. As we get a little bit older, those are the first muscles to atrophy. So that means without growth, they begin to wither. And now the knee is unsupported. So it's so important that we do some resistance training. If you're 74 years of age and 40 pounds overweight, yes, we're talking to you. I don't want people to feel ashamed or that they've missed the boat. There's also an expression, again, I'm borrowing all your lexicon from India, that comes from the Vedas as follows. The body has a memory of its own wellness. If all of our listeners, as we're now speaking, were to smell the smell of their grandmother's kitchen, they'd know it right away. Maybe they haven't smelled it in 3 decades. But there it is. Likewise, that memory of our own ideal function is baked in to our consciousness. So we're just going to kind of start moving in that direction. So if you haven't done anything in 30 years in the way of structured activity, no regret, no self-flagellation. This is a perfect time to start. And it's with anything, anything. And I want to mention this. This is a little departure, but I want to talk about dementia for a second, apropos exercise. We're doing an incredible study here at UPMC. And again, I feel like I'm pandering to you, but there's a physician in India who came to our attention, who has been looking in India at cognitive impairment for decades. And he has developed this notion. He's figured out a way to move the coils This is not in my wheelhouse, but Vishal, there are coils on MR that let you kind of tune into certain. Vishal, you still there? There you go. Sorry. I can't hear you, Vishal.
I think I was on mute. Yeah, there's
Oh
some
yeah.
network
Okay.
issue. So I'll just turn off my camera for a minute.
Okay.
Yes.
Perfect.
I'm listening though. I'm just here. Yeah.
Okay. So this physician in India has been measuring a product in the central nervous system, a glutathione derivative, and has developed very extensive experience on this purely natural product. One of our neurosurgeons here was so impressed with this work that he dipped into his own research foundation, brought the physician from India here to Pittsburgh, and they are now doing a study on 300 young maritime warriors, actually Navy SEALs, who get closed head trauma from flying in boats at 50 miles an hour. And we're going to start replacing glutathione. This physician in India demonstrated how cognitive impairment relates to synaptic fatigue, not the amyloid plaque downstream, but a fatigue and lethargy in the synapses, which again, we're going to fire up activity. So we'll keep you posted on that in maybe in future. But that is a really important thing because we think we've chased the dog, that we're really, I feel like we've gone up the wrong tree here. That is to say, the plaque is down, that's smoke, but the fire is the synaptic fatigue issue. So I want activity because activity stimulates the central nervous system. So if you're 74 and you're living in Hyderabad and you don't haven't, this is the day. Anything, anything. Walk twice to the kitchen. Do it in the morning. Feel that little wind in your forehead. Let it remind you of things that are long gone, like the glory of your 19-year-old incarnation. Okay. We don't give up the banner. Okay. My American hero, Thomas Jefferson, said back in the 1790s that walking is the perfect exercise. You know what? It is. Go do it. More is better. You don't, and we have recent data here that even that all the step counting businesses, there's no endpoint, by the way, to the number of steps that you count. It's another stupid, idiotic thing. But duration, so several walks, particularly in the morning. But don't sit still. Satan comes to get you when you're a lumbering puddle of flesh on the couch. Okay. The exercise is 3 hours a week in some form or fashion that you like. We talked about knowing yourself, having that value, and knowing what your parameters are. We talked about the right agenda, the right circadian rhythm, which is much more emphasized in the Indian tradition than it is in America. You, again, own that already, then live by it. Curating the diet, and in general in India, look backward. Think about your father's father's father, and maybe give thought to the wisdom of his moment. And the last thing has to do with the joie de vivre, the joy of life. So I've noticed among my Indian colleagues and patients that, alas, you have been afflicted by the same free-floating anxiety, contained terror that has maybe come to be a new normal for us. Okay. And if we could draw blood and measure happiness, we might find that the happiness coefficient for all of us is kind of at a new low. You understand that? So we should take seriously the premise of our own capacity for joy. A wise man in India once said, he said, happiness is the natural state of man. So if we ask ourselves, how are we doing? What's it like in my inner life? We find ourselves fretting. The most common turn of phrase in the entire of the New Testament is don't be afraid. So our young people watching, they're going to medical school, they have these exams, and it's true. I don't want to soft pedal the point with fake bromides. It's hard, but it's different. We don't. need to be afraid. You're powerful, secure, and invincible in your own domain. So we're not quivering specks in a corner. It's a very important premise. Okay. And so that's why we honor the body, because we're worth honoring. We're claimed by the Lord of the universe. So let's not be small in our thinking. Let's be a little bit grander.
Yep. Uh,
Does that make sense to you?
Yeah, absolutely. That's like I really loved what you just said, and I really will, apply it in that way. Will work on myself. I think there's so much to learn for sure. I will definitely get back to you for one more session, and there we'll talk about
100%.
how to, focus and improve, or like focus on the happiness on that aspects also we'll discuss. One question I had is about while we talk about the exercise, and there's always one question comes, is running better, or just brisk walking better, or just regular? But you already mentioned that any sort of walking is better than nothing, right? But where do
You're
you
right.
place running?
So, in general, there's a paper in circulation years and years ago that is an amazing paper that nobody remembers. And I'm just going to put it out to you and your very erudite audience. And it's interesting. It looked at vascular well-being, a basic science, the really hardcore basic science, not breast, buttocks, body hair, that kind of, but just basic science. And it looked at women participants in the Summer Olympics, asking who among this field of elite athletes is really in the best vascular shape. The interesting thing is not just the rank order, that's interesting, but the gap, which I'll tell you about in a second. So, turned out in that elite group of athletes that by far the most sound vascular fitness was achieved by the rowers, the scullers, followed almost equally, kind of a photo finish by the swimmers. Then there was a giant gap to the bikers, and the runners were nowhere in the room. And what interests me is the gap. So who would have thought? And since then, people say, well, what's so good about swimming? Of course, I mean, most of us can't habitually swim for a variety, but I'm just, and nobody knows that. It's not, well, there's no orthopedic injury, maybe, but there's something deeply fundamental about this, about that domain of, and if you think about it, the people that you knew growing up in, in high school who were swimmers, there wasn't one of them that wasn't cut to perfection. So it's just an interesting. So here's the thing about exercise. I'm not the biggest fan of um, of running as a standalone event. I know a lot of the medical students are thinking, hang on. So it's easy to put your shorts on and your sneakers and go run a couple, 3 miles and so forth. And that's fine. God bless you. But if we thought of it a little differently, Vishal, what if we thought about this? Think of it like an investment. So should you invest in Exxon or should you invest in Chevron? And the truth is, you don't really care about the company. You care about your return on the investment. So if we thought about our exercise that way, well, how am I actually honoring the body? You know, if you put together a combination of weight-bearing activity, let's just say that you did that 3 times a week. And let's just say that we took as a general axiom that we don't, that weight bearing means things that we can do 12 times. So we don't lift up. In fact, there's a little bit of a rumor, not established fact, but it's innuendo that there's an increased risk of sudden cardiac death among the heavy weightlifters. And that's not what I'm saying, but things that we can do 12 times so as to create muscle memory. Um, Walking is perfectly fine. Okay. I'd like the pace, though, the pace to be a little bit quickened. And our data in America suggests you don't have to do the whole thing in one fell swoop. So there's nothing wrong with, again, it depends on level of fitness, age, acclimation, and so forth. Certainly, going out and walking a brisk 5 miles, particularly in the morning again, is a great thing. But you could also do several little aliquots. No difference. Okay. So I'm not the biggest fan of running. When you look at it over time, there's a price to pay. So the orthopedic trauma of running is not trivial. On the other hand, the most important thing about exercise is that you enjoy it. It's not a penal colony. I'm not asking people to hold their breath for 3 hours a week. It should be fun. And the Ayurvedic teaching on this is as follows: that A, it should be enjoyable. B, that if we thought about breathlessness, so Vishal and I, as we sit talking, are at level 1. We can have long discursive sentences and we're not short of breath. If Vishal was out running up the hill outside his house at a rapid rate for the second time, and I said, Vishal, when are we going to do our next? I'll talk to you later. That's level 3. So level 2 would be I ask Vishal a question. Vishal, what do you think about the medical students at this? And he can answer it comfortably. That's level 2. That's kind of what we aspire to. Okay. Just that, we know that we're exercising. We're not sitting having a smoke. We're not watching TV. But we're not, holding our feet, on the other hand, to the fire.
Absolutely agree with it. And I am also a big fan of swimming. I mean, like more than running, and that really helps.
Wow.
Yeah. Yes.
You can't, but everything I said to you probably is understated. If
Yeah.
you if you can find, I don't, if it's you have, and think about this other thing. Think about the other premise that it highlights, Michelle. We talked about how we serve the body by getting out of our comfort zone. So if you go swimming, you have to go to the pool, you have to take off your clothes, you put on the bathing suit, go to the pool, get out of the pool, go take the shower, come out to the hospital. So you're more out of your comfort zone, right? But that's something that actually recommends it. I did my fellowship at UCLA, and it's so interesting on the campus of the University of California, Los Angeles, way away from the medical school. There's a giant pool. I mean, it's crazy. And there it is with all the beautiful plants surrounding it. For me being from the Northeast, you go there in February and everybody's walking around with no shirt on, jumping. And the people, there's no question in my mind that the people that went up and did that. So we were trying to figure out, we're talking about echo. So this is the time when color flow had become evident. And one of the thought leaders in the world on echo was at UCLA. And he was trying to figure out when a valve closes, you see those little whirls and eddies, what's normal, what's not normal. So my only contribution to the non-invasive literature was, after doing one of my little swims, not like these other guys but in California, you stand on the bench. You don't sit on the bench. You stand on the bench to dry. Don't ask me. So I'm standing on the bench, drying myself, getting ready to go back to the hospital. And in comes the water polo team, the UCLA water polo team. Now, these kids are just perfect. So I thought to myself, well, we should use these kids. You can't do water polo if you have aortic insufficiency. You can't. So when the valve closes, that little whirl and eddy of color flow, we'll call that normal.
All
Okay.
right.
So we used the UCLA water polo team to help define the echocardiographic criteria for normal valvular regurgitation. And you can't use the runners. You can't leave. There's those guys that are in the water. So there's an expression in Los Angeles, 2 words, which I would recommend to your viewers and listeners. And it is this: get wet, like Vishal. If you can just include that in your program, you are leaps, bounds, and standard deviations ahead of your colleagues.
That's amazing. Coming to the last segment of this session, sir, about that academics health done. Now let's come to the mental health and how sort of as a doctor we feel burnout sometimes. So what's your go-to way? I know you're also an actor. You have already acted in one of the movie. Please enlighten us about that journey and how one should figure out their way.
So we were talking before about the 5 pavilions of stewardship. And we had the last one as joy. So nobody knows the ardor of becoming a physician except the people on this podcast who are becoming physicians. My son is a medical resident here at UPMC, and I'm reliving all of this contained nightmare. Okay. So it's very important first that we recognize these young champions and hold them out. And it is the case as that it's very hard to become a physician. I don't care. You're in India, it's hard to get into medical school. The acceptance rate at UPMC now, think about this. So you took two inorganic, two organic, two biology, two physics, two chemistry, you killed it. You got great grades, you got a high MCAT. That's the applicant pool. And of that pool, the acceptance rate here is 1.7%. And then they have you. Now you're in the machine and you've been top five medical. So they're going to extract their pound of flesh. Okay. So let's be real and talk about that. We have to protect ourselves. It's very important. A wise doctor once told me, it's very important that every day, we do something, anything that has no other reason for doing it except joy every day. So the heart loves joy. And we get into this kind of hanging on a cross a little bit where, you know, when we come home, we're going to sweep the floor and then we're going to feed the so forth. All that's fine. But when we walk home, we stop and just have that moment of gazing out at the lowering sun or the appearing stars, or that has no other reason for being but for the gathering of joy. Dr. Freud once said, Sigmund Freud said that depression is grief over something lost, actual or symbolic. This I want to talk to the young medical students about. You feel there's a sense of loss. Your friends are getting married, they're having kids, they're getting jobs at banks, and you're toiling away, single, uncertain of yourself, in a kind of continuous frenzy. And all that's true. You are doing that. Um, there is no greater pleasure or honor on earth than caring for patients. But that means that we begin by caring for ourselves. So if you didn't listen to anything else that Vishal and I talked about today, fair enough. But we need that little cup, that little bit of sucor on a daily basis. I spend an hour and a half a day in meditation. And I've been doing that for a long time. And certainly but I'm just asking that we take seriously the premise of our own happiness and that we at least ask ourselves, how are we doing that way? Um, and I want all of us to be a little bit, I've been thinking about this, and a friend of mine is a deep thinker, and he worked for a senator, a very well-known senator in Washington, D.C. And the senator asked him recently to look at the Magna Carta and help him understand it. And this is the point. In the Magna Carta, we stopped being vassals. We stopped being serfs. The Magna Carta held up the transcendent identity of every human being as a consequence of their relationship to God. Every human being. So that includes all of us that are low on the feeding chain in this or that domain, or who got this thing wrong, or who made a mistake. These are the ways that we stop accusing ourselves. It's really, really important. We stop, doesn't mean we're sloppy, none of that, but we don't hurt ourselves. The joy of life is so important to maintain. And lastly, Vishal, if you and I are walking across the Mojave Desert in California, and we know the oasis is 13 miles away, the ardor of the trip is minimized by knowing the sweetness of the oasis. likewise for my medical students. What you've chosen to do is the highest choice, period. I've been doing this for 44 years, and I'll tell you that with categorical certainty. There's nothing on earth like saving a person's life. Nothing. You'd be the banker and all the people fanning your forehead and giving you peeled grapes. It's all vanity. It's just, so you guys, in Matthew, there's a passage in our scripture in Matthew, there's a passage about how it is that the greatest among you all is your servant, and that's us. So you've made these choices. They're wise choices. They speak so highly of you. But care for yourself in this. So when they come after you and they come maybe yelling that you should just put the arms across the solar plexus so it doesn't get too much inside of us. Quietly hum a little bit of a tune to yourself, something that you, and it all passes. But we don't lose ourselves in that moment because we didn't check the magnesium. Okay. We do the best we can, and the best we can for all of you is way more than enough. It's way more than enough. Okay. So I'm very concerned about this among my young physicians, my son included. The task that you have at hand, nobody knows. Your mother doesn't know. Your father doesn't know. You know, Vishal knows. I know. Your friends know. And so I had a medical school reunion the other day, and I went back to Georgetown. And there's some difficulty in it. You look at the number of people that have ceased to be. People that I remember as fresh-faced kids sitting in LA6, thrilled to learn about this or that. Um, so you are the most precious commodity on earth. Take that seriously. Have fun. Love, love what you do, but don't be consumed by it. No dog bites man moment. You're in command of this. And you get through this. It passes quickly. Honestly, it does. I spent 17 years of my life training in one capacity or another, 17 years, but it was all okay. I wasn't like waiting for the end. Once you're a medical student, you've made it. Dude, you've made it. Okay. But I think that what Vishal is trying to do, here comes a little heart from somebody, but honestly, you know, there's an old adage from the scripture about don't show your pearls before swine. And I mean by that, keep your inner life intact. You don't have to, just understand that there's the public tooth and the private tooth, and protect the private tooth. Take it seriously. We have a long way to go for many of us, but the oasis is there. It's in sight. We're going to reach it, and our feet will be in the limpid water, and you'll be sitting in the shadow of the date palm.
That's the incredible answer I've ever got on this podcast. Honestly, I mean, like the uh, the way you talk, it's like a poem itself. I really must say. I'm sorry if you feel like I'm just praising, but I felt it that way. Directly, went out to the heart, and I really felt it. So, I
And our
mean,
listeners feel that. They feel that. They know the heart. Remember that you understand a poem before you know what it means. So the heart always leads, okay?
yep.
You know, I gave a TED talk here, and they said, well, give the TED talk, but don't talk about politics or religion. What else are we going to talk about? Okay. And so we know that God's law is written in your heart. Okay, you are the crown of creation. So act like it. You're not afraid. You're not a quivering speck in a corner. You're powerful, even in these moments where you're the third year medical student doing the rectal exam and it's 3:30 in the morning and your feet hurt. This is the great joy of service. Don't miss it. Don't miss it. And I think that what Vishal is doing here is so, you get enough lectures, you get enough this and that and the other thing. And in any case, you really learn by experience. But we need to serve two audiences, Vishal, I think. We need to bring the most erudite thought to our everyday citizens so that they are empowered. I don't like the word, it's a little bit, but they're empowered to and inspired to care for themselves. And in the meanwhile, for our care providers, um, remember, you truly are the crown of creation. Vishal and I will slowly fade, and you'll rise into this moment that you'll never forget. You'll be worthy of it, but care for yourself as we're crossing the desert, heading to the oasis.
Okay. Thank you so much, sir. I think we almost discussed for 1.5 hours. Last, I would love to hear from you about the one thing that as a person you should stick to throughout their career to grow and to live with the happiness and achieve what they have dreamt of with the healthy relationship with their peers. So, what's that one thing, or maybe a couple of things, which you would like to guide us?
The first thing is if we're going to push off the dock on our sailboat, like you're pushing off the dock of your on your career, the vessel needs to be seaworthy. We need to know that as we step onto the boat. And the further we get from shore, the more important that premise is. So you, as a sovereign human being, need to be seaworthy. And that means the following. If the boat that Vishal and I and you got on, and it turned out, little did we know, it doesn't have a keel. So every time the wind changes, it's going this way and that way. We can't make any forward progress. They all look the same on the dock. But now we step onto your boat. And your boat, as Vishal and I and our friends step on, has a deep keel. And so when we sail out, though the keel is invisible, it's what's giving the direction. The boat doesn't mind the wind comes, goes, tide rises. No, the keel keeps it straight. And the keel is your spiritual identity. It's your being fastened to the God that loves you. And knowing that immutable truth is what keeps you on tack. They come say this, they give you that, you this, so forth. But we're not fragile. We're not fragile. So you be the boat with the deep keel. That when I watch you and Vishal and others say, I'm on the dock now, and there you go, I watch, and there's the tiller, the man on the tiller. And he doesn't have to do much because the boat sails itself. It makes its own way. That's you. So we're not, and it's very, very important that that spiritual identity, that attachment to the immutable God be at the core, at the foundation of your identity. Okay. And it's something that we oftentimes, we're 23, you've been doing this and that. It's not an urgent priority. Yes, it is. You don't get on the boat with no keel. We'll all end up in the damn cold water. Okay. So I want you to have that attachment. Okay. And then the second of the three pedestals is once you have that attachment, you don't have fear. You don't have fear. Oh, you're on call, just stay. That's okay. Why? You're strong. You're powerful. Yeah, but it's 4:30 in the morning. You're strong. You're powerful, and you're engaged in the most important and worthy task that there is. Okay. And then the third thing is have fun, a little fun. Now I'm not a fan of any. I did a TV show the other day and the host asks me, he says, Oh, Dr. Donohue, tell us what you think about marijuana. I'm not a fan of marijuana, by the way. And I said, I don't think
Okay.
any of your, just be sober. That's when you're intact.
Yes. Uh, I think we can conclude over here, sir.
Good.
And I'm really thankful again for this session, and I will request you one more day from you so that
Yes, be my
we can
pleasure.
deep dive in your views about the Ayurveda and the traditional things, and also a few more things. I would love to hear, like, I really enjoyed this session. I would must say that
Well,
this is one of the best podcasts I've ever done till now. I've shot with 15. I don't know disrespect with the others, but most of the times what we draw from the podcast is for the viewers. But this time, I think it was for me Personally, I felt it so enriched, and definitely, I'm 100% sure that all my viewers will also love this. So that once they have the idea about that, they'll definitely ask me in the comment section that, sir, we would like to join live next time, and we will come
Oh, that's
again.
good. We'll join it. Right. And Vishal, I have one thought for you. In the ninth mandala of the Rig Veda,
Yes, sir.
there's a passage that goes as follows. He who knows the country gives the direction to him who asks the way. So in our next session, I'm going to surprise you and flip the script. Listeners, now don't drift away. And we're going to hear from our host the inner workings of Ayurvedic healthcare. So we'll learn from him who knows. How about that?
That will be good, so that will be great. I'll try to read most of it as we most of the time we are also following the same modern medicine. So
I
I have
know.
a limited knowledge about that, but for sure I'll speak with the experts and maybe I'll try to bring someone else as well who is like keen to speak about it. So that will be even better.
One of the things we can talk about that is so powerful is pulse diagnosis. And
Yes.
this is an entirely Vedic, Ayurvedic tradition. But and again, we're not, the medicine that you're learning is the medicine that matters. But
Yeah.
nobody that I know has a full command on all knowledge and power. Okay. So so in the Ayurvedic tradition, the pulse is the entire innocent mirror to the physiology. So we as healthcare providers could just learn we don't need to learn about roots and all this, but we need
Yeah.
if it's a way of becoming familiar with the patient and being more effective as a servant. So maybe the next time I'll give you a little brief review of that. I've actually had that done for myself on a number of occasions. And it's just something that our friends in India could make available to themselves so they have just one more arrow in their quiver.
Yes, for sure. So I think this session inspired me a lot to read about the Ayurveda, and I'll also go to the practitioners, learn some skills. The whatever,
Great.
yeah, whatever I'm practicing, I'll try to add on onto that, and give the best out of it. That's the goal.
That's it. That's it.
Yes.
Pick the choicest of the berries.
Yes. Thank you
Well,
so much
thank you
again,
very
sir.
much.
Yes, I'll just
That
take
was,
a picture so that,
oh
yeah.
yeah.
Yes, I've taken a screenshot which will work as a picture. And I think we can conclude this session. If students have any questions, few of the students were there since first moment itself, and I think they love the session. Do you want to share any thoughts?
Yes, invite the students. Where are the students? I just
Nuzhat
saw.
is there. I can
Yes, Nushat
unmute
is there.
you. Yeah. I
Hello, sir.
Hi, 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 hi. How are
Yeah,
you?
I'm good. Thanks. This session was so good, sir. It was so good.
Your voice is actually breaking, but I guess
Hello.
that's okay. I'm
Tell me
understanding.
again, Nushat. Tell me
Mhm.
again.
This session was so soulful, sir.
It's breaking. The audio is breaking. I think she's not in the connection. Zat, you can message me. Okay, this
Here she
podcast
is.
was awful. Yeah,
Soulful. Oh,
that's
Nushat, that's a high compliment that we as physicians would talk in a soulful way, right? So,
yeah.
and we can't, on the other hand, forget our soul. Can you imagine being a physician as an empty vessel? No, you're the most soulful. This is the most soulful. The old English word for doctor comes from an origin akin to priest. So for us to just be these kind of, these empty vessels talking, we take care of human beings, and honestly, it's the highest task that there is. And I think that's I don't know if Vishal, but I think one of the tasks of this incredible podcast that he's uh, curated is to combine the rigor of what is it, why do we have aortic dissections, with the deeper knowledge of who it is that we are. Yes, we have to take care of our aorta, and it's an interesting thought. Just one last thought. There's a great mystic poet in the English tradition named William Blake. And William Blake had this notion that in every stitch and scintilla of the creation is the creator. There's no gap, okay? And so that would mean that as we care for these patients and as we care for ourselves, we're caring for the creator, okay? If I was to call up one of these wonderful students here on the board and say, hey, I painted this painting. I've been working on it for the last 2 years. Could you just take a break and come over and look at my painting? And when you stood in front of the painting, my ambition would be that you love the painting. Likewise, the creator wants that you love and are fulfilled in the creation, you see. And so, and what the work that you guys are now doing allows people that full breadth and knowledge. The word health, Health in English, comes from a Sanskrit root which means sanswat, which is to be established in the big S self. So you could argue that the reason to take care of your arteries is because they support those fuller levels of consciousness. And in the West now, we're beginning to talk about this. And I want to close with this thought, Vishal, and it's the following. There's an important book I would love people just to either look at or look at the review of, called The Master and His Emissary. The master is the right brain. The right brain is the repository of the sublime, the transcendent, and the divine. The left brain is the taskmaster. The left brain, all the things that Nushat and the students have to do today, that's codified in the left brain. So the left brain was the messenger, went out and did the tasks, but the right brain was the sublime director of all things. Not so anymore. So what's happened is we've had a usurpation of the left brain. And it's interesting, all the way back through salamanders, the nervous system, curiously, is divided into these two hemispheres. You might think that you'd want to put all your eggs in one basket, but that's not the truth, and that's not the divine orientation. So if you, for example, look at all the paintings in the Western tradition of the mother holding the child, the mother she always holds the baby with her left hand. You never see, because the left hand is such that when you look at the baby, you look with the right eye. The baby just came from the unbounded, and you look and gaze upon the baby with wonder with your right eye. That's the basis of your relationship. When the birds in India come to the ground, they're worried about the snake is coming. So the eyes don't travel in a monocular way. So the left eye helps her find the grains coming and the worm. But the right eye separately moves to provide guardians against the snake and the hawk. So the right eye provides context. We as a group, you in India, me here in America, have drifted from that, the missives of the right brain. And I'll tell you this, that is where our anxiety, our emptiness, and our impoverished inner lives come from. We've left home, okay? And it's important, and I hope to share with you some thoughts on this in our next iteration. But it's imagine that you young people, it's hard, but imagine you had a young child, and child is 3 years old, and his name is Sean, and you're in the train station in a giant city in Hyderabad in India. Trains are coming in, out, dust is around, people running and bustling, but you've got Sean's hand and you're holding it tight, and he feels your flesh as you feel his. And it's all okay until someone bumps you or bumps Sean, and now your hands are separate. Terror. That's our current moment, that we've drifted away from our maker and from ourselves. And that creates this moment that we all experience. And so this is now being iterated, and we need to begin the journey of coming home again, which is part of what I think Vishal has in mind in these productions.
Okay. I think we can conclude the session over here, sir. I thank you again, and I'll get back to you on your WhatsApp so that we can plan on to the next session, maybe after a couple of weeks, so that students get ample amount of time to watch this video on YouTube, and they'll request me themselves that please keep it as early as possible.
Absolutely. And I want to give a shout out to Tuba Siddiqui. Dr. Siddiqui, I hired a young man named Dr. Siddiqui. I came to love the name and the whole background, and thank you for joining us, and we'll see you again.
Thank you, sir. Thank you. Bye-bye, sir. Have the best day. Thank you, Nizam. Thank